Okay, I have cried about this a lot, so anyone who's going to be mean about this.
Hi there. So this is a video for this pet parent who is asking for support, who is dealing with intra-household aggression with their puppy and their older dog, and that is my specialty, is intra-household aggression. And my best hope is that this video makes this pet parent feel a lot better and gives them some guidance as to where to go from here, as well as some insight as to what's going on, because unfortunately they've gotten some really bad information. So, as I said, I specialize in intra-household aggression. I'm a certified dog behavior consultant through the IAABC, and I have my bachelor's degree in psychology and sociology. I own Best Life Dog Services, and I specialize in aggressive behavior and nervous system dysregulation with a subspecialty in intra-household aggression. It's something that I've lived with personally, as well as worked on dozens, if not hundreds, of cases. Intra-household aggression is really, really challenging. I think it's one of the top 3 most emotionally challenging types of behavior cases. The other 2, I would say, are family-directed aggression, which is also a concern here, and separation anxiety. And that's because it affects your whole life. There is no downtime. If your dog is reactive on walks, then it's a problem when you're on walks. With family-directed aggression, with intra-household aggression, the concern is all the time. The hypervigilance is all the time. So first of all, we have one piece of information that says the dogs are having conflicts daily. I have a blog post on the variables that impact an intra-household aggression case on our website, and frequency of fights is one of the big ones. I know that this pet parent has said that they don't want to separate the dogs, but that can often be a necessity, at least in the short term, to prevent these fights from being rehearsed. The more negative interactions they have, whether those are tense moments or full-blown fights, the more the relationship deteriorates and the worse the prognosis becomes in terms of being able to get back to a positive relationship or full integration in the house. One thing that seems to be really stressing out this pet parent, which makes total sense, is that this behavior only happens in their house, and it only, the family-directed aggression, the reaction to being picked up or coming into the dog's space only happens with the pet parents. And unfortunately, they have connected with a trainer who does not practice evidence-based practices, who has employed shame here and told them that this is their fault, and making them, that their anxiety is making this problem exist, is causing this problem. And kudos to the pet parent for saying, well, obviously not, at least at first, because we weren't anxious the first time it happened, it had never happened before. It's a really normal adaptive nervous system response to say, when I do this, something physically unsafe, something violent, something damaging happens. It's normal to be anxious, engaging in behaviors that cause your dog to bite. That is normal and a healthy response. This is not happening because the dog is trying to be dominant. There is no interspecies hierarchy. So dogs are not trying to be dominant over us. That is a myth that has been debunked for a very long time scientifically, but unfortunately is very pervasive in popular culture. It's not uncommon for dominance theory to be paired with aversive training methods, such as approaching the behavior concern through the lens of correcting it, and using tools like prong collars, metal or plastic. It doesn't really matter. The point is that it's aversive. And so responding to a dog's behavior, responding to their communication, responding to the symptoms of their distress with punishment is actually well documented to increase aggressive behavior, to increase anxiety, which is often driving aggressive behavior, and to create aversion between the associated stimuli. And so this can actually make things much, much worse. It actually makes total sense and is very common that this behavior is only happening in the house and that the family-directed aggression is only happening with the pet parents. This doesn't mean that the behavior can't be worked with. It does mean that it will not be effectively worked with using the methods that this other trainer is using. I think we tend to think of aggression from animals as very black and white, but their relationships can be as nuanced as ours are as humans. Inside of the house, you have, that's probably one of the safest places for the dog. And so you might be more likely to see a fight response in situations where the dog feels familiar with where they are, socially supported, surrounded by safe people, etc. This is also likely why we're seeing only a fight response in response to the pet parents. It's very unlikely that the dog is actually comfortable with other people picking him up or moving into his space, but may not feel confident enough at this point to respond aggressively. I would not be surprised if that changed if we keep engaging in that behavior and having the dog in situations, right, where he's trying to communicate that he does not like this. And spoiler alert, there are some really big red flags here for pain. I would absolutely talk to a veterinarian about what is happening here and look into pain in his body. So we may be more likely to see that fight response, that aggression, over the other responses, flight, fawn, fidget, freeze, in spaces where the dog is familiar, like their home, and around safe people. If our training approach is to set the dogs up to engage in the aggressive behavior and then correct that behavior, things are going to get worse. Best case scenario, the aggression gets suppressed in the moment, but we haven't changed the emotion, we haven't addressed the underlying function of the behavior, we haven't addressed the stress levels, and so that behavior will pop up elsewhere. Worst case scenario, we will lose our warning signs that aggressive behavior is coming, and then we will see aggressive behavior that is more intense than we have seen before. So this isn't about setting the dogs up to engage in the behavior so we can correct it. And your trainer shouldn't need to see aggressive behavior to address it. That is a very red flag. Again, it is imperative that we prevent the rehearsal of the behavior, that we keep everyone physically and emotionally safe, that we prevent negative interactions from strengthening the deterioration of that relationship, that we prevent that fight response from being reinforced. Surviving is very reinforcing. So every time that behavior is practiced, it becomes more reinforced. It's very important that we have management in place to prevent that behavior. Going back to why the house can also be the hot spot, we're also there not only talking about being on familiar ground where we're safer, but there's also usually more resources and tighter spaces. And the three most common catalysts for intra-household aggression are tight spaces, arousal, and resource guarding. Another factor here is absolutely that it sounds like this behavior started around the onset of adolescence. It's really important to note the intersection of the developmental period that our learner is in. This is a common place to see reactive behavior, resource guarding, that sort of thing begin, but it sounds like the onset was very sudden, and it sounds like it is more intense, certainly when we're seeing aggressive behavior, dog fights, dog bites, than we would expect to be typical of the adolescent experience. Again, I think the presentation of this, the sudden onset, the specifics of the behavior concerns definitely warrant a health check. There are a lot of red flags here for pain or other physical health issues. So this would be my recommendation. I would recommend discontinuing the use of aversives, punishment, intimidation. Any attempts to be dominant are likely secretly punishment based, whether that's intimidating body language or yelling at the dog, pinch collars. I would separate the dogs. I would give them a break from each other, let them feel safe in their home, let them engage in their enrichment activities safely and separated. I would absolutely prioritize a vet visit. I would discuss the catalysts for the aggression, the handling, the moving into space when the dog is settled, the sudden onset, the intensity. And then I would recommend connecting with behavior professionals who can be of support. I might start with a veterinary behaviorist, which is a veterinarian who's done like an additional 10 years of school to specialize in the intersection of physical health, medicine, and behavior in all the species. A common misconception is that we need to deal with the behavior concerns physically in the environment where they happen, but we often want to deal with them. We want to deal with them within contexts where the dog is not triggered, where they can learn. And so I find virtual work to be ideal for intra-household cases. My presence is going to change things up as this pet parent is seeing. The behavior doesn't occur when we have that novelty in the environment, that distraction in the environment. So I recommend virtual work, but I would also be happy to help this pet parent connect with someone locally who could help them. I'd be happy to help them with finding a veterinary behaviorist, etc. So they are more than welcome to reach out. I'm happy to send resources. I know that this is a really, you have two really challenging behaviors to deal with. This is not your fault. And I hope that you are able to find the appropriate support. Let me know if I can be of assistance.